CDC is out today with new guidelines for concussions. They're the first evidence-based clinical guidelines in the U.S. for diagnosing and managing concussions in children. Health editor Dr. Maria Simbra has more.
New guidelines about concussions in children from the Centers for Disease Control and Prevention. The 19 recommendations focus on diagnosis, treatment, and prognosis. A number of them address brain imaging. In fact, advising against imaging because the results are normal with concussion. Certain red flags, though, would push toward testing.
Nausea, vomiting, severe headache, doing something neurologically that doesn't fit normally, emotional outburst, can't smell, can't hear, can't taste, can't see.
Similarly, no blood tests for the same reason.
We don't have an image or a serum marker or a biomarker to diagnose this injury.
Diagnosis should be based on history, exam, and assessment with validated tools. Rating scales are commonly used for this, with questions about physical symptoms, thinking issues, and balance.
Every concussion, because it affects different parts of your brain, it's hard to standardize it.
After a period of rest, activity and academics should be gradually increased, with extra attention to good sleep.
Getting kids active, probably within a week or so after, is probably a good idea. Light activity is a really good idea. Getting back into the swing of things, making that brain work a little bit but not overwork.
The most strident recommendation is education on concussion for parents, players, and coaches. The experts behind the guidelines favor renaming concussion mild traumatic brain injury.
Using the word brain injury, it helps us understand that this can be a very serious event that needs to be managed very carefully. So you have to individualize care. I believe concussion is a treatable injury. I believe we can get kids back to the sports they love.
The guidelines are based on studies published between 1990 and 2015. Taking care of traumatic brain injury in children is a rapidly changing field. The CDC expects to update recommendations as more study and analysis come out. I'm Dr. Maria Simbra, KDKA-TV News.